the coronavirus, and of course, as we're hearing that third wave could be possible in South Africa. We're now joined via Zoom by senior medical epidemiologist at the National Institute for Communicable Diseases, Dr Harry Moultrie. A very good afternoon to you, Doc. Thank you so very much for giving us your time here on SABC News, sir.
Absolute pleasure, and good afternoon to your viewers.
You're most welcome. Let's talk about the factors that could trigger a third COVID wave in South Africa. We're hearing a lot of talk on that. Was it, for instance, perhaps not the right time to move to alert level 1 and relax restrictions, particularly given the fact that, you know, we're moving towards the Easter season, and that might also be a factor contributing to this third wave that is imminent, as we're hearing?
I think it's important to note that there is a potential for a third wave, and there are various factors which may contribute to that, and I'll touch on that in a little bit. But in terms of returning to level 1, I do think it was at the right time. Cases were declining, hospitals were coping, and we have to balance livelihoods and lives, and so we can't maintain restrictions unnecessarily for prolonged periods of time. However, there are a potential number of factors which could result in a resurgence or a third wave, and most notably is behavior change, whether people are adhering to social distancing, NPIs, masks. Easter, with large social and religious gatherings, is potentially a point, if we do not adhere closely to NPI measures, Easter could potentially kickstart a third wave, and it does remain a concern for the National Department of Health and NICD, and we're monitoring it closely. So we would request and advise people to behave responsibly over the Easter period, maintain social distancing, avoid large gatherings, avoid indoor crowded spaces.
Dr. Moultrie, not enough people have been vaccinated to create the term that we've recently learned. Of course, you in the medical fraternity, it's obviously an old word to you, I suppose, to create this herd immunity that we've been hearing about. The Deputy President, was quite disappointed. I think it was yesterday or earlier today, saying that we aren't really getting to that point where we could have a herd immunity, and I wonder from where you're sitting, is slow vaccine rollout is better than no vaccine rollout, correct? But what needs to be done in order for us to get to the point where we can have this herd immunity? And are there still negative perceptions perhaps around the vaccination? I'm trying to get to why we're stalling so much.
So ideally we would have large-scale implementation of vaccines before any resurgence or third wave. Unfortunately, given the current scale of the implementation under the pilot rollout research project for healthcare workers, it doesn't look likely that we are going to reach the kind of vaccine coverage or scale that we require in advance of a potential third wave. I think that the teams are working hard to vaccinate healthcare workers, but unfortunately we are somewhat limited by the supply chain, the access to vaccines. And that's not just a problem in South Africa, but in many developing countries. There does seem to be a maldistribution of vaccines between the developed world and developing countries, or less developed countries, with some countries having more vaccine doses than people, which is obviously inappropriate. So I think that we need to apply more urgent pressure on the global community to ensure that vaccines are equitably distributed globally and rapidly.
Doc, it seems with each new wave, the sort of strain becomes more severe. Is it a case of the strain becoming more severe, or a case of the fact that it is a new strain that we now have to deal with? And so obviously at the beginning of that strain, things do look bad. I mean, what is the science around all of that? Are they more severe, or is it just that we're now having to contend with a new strain?
the virus continues to evolve, and predicting its future evolution is difficult.
Yeah.
Having looked at the recent new lineage, the 501YV2 lineage, it does look like it was likely a combination of increased transmissibility and possibly some indication from the NICD hospitalization data and elsewhere of a slight increase in severity with the new strain. As we look towards the future, we know that the virus will continue to evolve. We just don't know how and what those evolutions may result in. It is possible that future mutations could result in increased transmissibility or increased severity, or perhaps even immune escape, where people who've been previously infected with SARS-CoV-2 and had COVID-19 become susceptible to reinfection. So we have to keep monitoring the situation closely. It is important that we maintain our social distancing as best we can, and that we roll out vaccines as fast as possible.
And just in terms of those vaccines, you'll remember we had this huge batch of AstraZeneca vaccines arriving in the country, and then we were later told that they couldn't, there was a lot of stories around that they couldn't deal with the new strain and so forth. And then I'm just wondering, let's just say we acquire a huge batch of vaccines that are great for this strain that we're currently dealing with, but then later it turns out that it's not great for the third wave, the third strain. What then? And is that a legit concern for us to have as South Africans?
It's not only a concern for South Africans, but also for the global community. As we see with influenza virus or the flu, every year the vaccine gets updated in order to try and anticipate the likely circulating strains of influenza. And our recent experiences with the COVID-19 vaccine certainly indicate that a second generation of vaccines is required to target the new strains and lineages, and those are being developed. I suspect in the long run that this might become an annual endeavor of assessing the circulating strains of SARS-CoV-2 and perhaps adjusting vaccines to better target the currently circulating strains.
All right, Doc, thank you so much for educating us on that. Much appreciated. We appreciate your time.
Good day to you and your listeners. Take care.
All right. That's Dr. Harry Moultrie, epidemiologist, at the National Institute for Communicable Diseases, speaking to us there about vaccine rollout, but really issues pertaining to the coronavirus indeed. All right, let's